So now I am going to demonstrate the procedure of Ryles tube insertion or nasogastric tube insertion. Okay. So what are the indication of nasogastric tube insertion? When the patient needs enteral feeding, but the patient is unconscious, patient cannot take his or her food by her own choice, then we have to insert some tube so that we can feed the patient. Otherwise, if you try to feed the patient in an unconscious patient, there can be introduction of food into the respiratory tract. That can cause aspiration pneumonia or choking. So in an unconscious patient, you should insert one nasogastric tube for proper enteral feeding. Another is any poisoning. To take out the poison, unabsorbed poison, we will introduce the tube and suck out the material. But it should not be any corrosives, alkali or acid. In that case, if early can be done, it is okay, but we cannot introduce it after a while. Why? There is necrosis or corrosion of the gastric wall. If you push it, it will penetrate the gastric wall. There will be perforation. So in case of corrosive poisoning, you should not introduce this tube. Another is in case of intestinal obstruction or any abdominal pathology before surgery, after surgery, to take out the intestinal contents, we can use the nasogastric tube. The first thing is, as I have said already in every procedure, is hand washing. After hand washing, so take one sterile gloves and put on the gloves. So sterile gloves, this is not sterile gloves, ideally it should be done in a sterile way, so I have put on the sterile gloves. So this is the nasogastric tube. First you have to measure the nasogastric tube, how much length you should introduce inside the nostril. So how can you measure? You should measure from the nares, external nares to tragus. This is tragus, from tragus to midpoint between xiphisternum to umbilicus, like this. So this, if you introduce this much, the tip will be inside the stomach, so in between, but you should not touch like this as I am showing, because it will be unsterile. So just take a approximate measurement. Okay, so I have taken the measurement. It is almost, if you take the measurement carefully, this is like this, 2. Can you see the marking? One black point. Ideally, if we introduce the nasogastric tube up to first black mark, that means the tip will be in gastroesophageal junction. If we insert up to second black mark, it is body of the stomach. If we insert up to third black mark, it will be on pylorus. If we fourth mark, it will be on duodenum. So our target is to put it on the body of the stomach. So second, and as the height differs person to person, so it is ideal not going by this marking, you should measure rather. Okay, that is the importance of measurement. So we have taken the measurement. Now choose the appropriate nostril, because someone may have DNS, deviated nasal septum. One may be larger, one may be smaller one. So choose the larger one, and the position of the patient should be, ideally it should be sitting with flexion of the neck, if the patient is comfortable. If any patient relative is available, you can ask the patient sitting and slight flexion of the neck. If the patient is unconscious, no one is available, you can do it in supine position also. Is it clear? But take consent from the either patient, if the patient is conscious and alert. If not, unconscious or semi-conscious, take informed consent from the patient relative and explain the need of this tube. Okay, then I am going to insert this tube. So someone who is assisting me will be giving some amount of this gel. This is local anesthetic gel, because I want to make this procedure less painful. Okay, otherwise it will be very painful. So you have to take some amount of gel. So I have taken some gel and apply it over the tube. Okay, how much? Up to which you are going to insert. Okay, now I am choosing this nostril. I am going to insert this tube. Usually when I am going to insert, first tip will touch the pharynx, then there will be gag. Patient will gag. That means now the tip is in the pharynx. Then I will ask the patient to swallow the tube, so that there will be closer of inlet of larynx. It will not enter into the larynx, it will enter into the food passage, into the esophagus. So as the patient is gagging, I will ask the patient, swallow. The patient will swallow. Then I am, as the patient is swallowing, if the patient is unconscious, no need to tell, because he or she will not swallow. Then introduce up to second mark. Okay, so I'm introducing this tube up to second mark. I will introduce. Then you have to confirm whether it is properly placed or not. So I am introducing. As you can see, almost the part which has measured. This is the second line. As you can see, so I have introduced a tube up to second part. This part is remaining. Now what you have to do, you have to confirm whether it is in foot passage or respiratory tract. If it is in respiratory tract, patient will cough it out. Like there will be vigorous cough, right? If something is entering into the respiratory tract, there will be cough reflex, vigorous cough reflex, and you can hear some hissing sound. If you place it near your ear, you can hear hissing sound. Means to and fro respiratory sound, inspiration, expiration. That means it is in wrong place. Number one, right place. How to confirm? You can aspirate the contents, gastric content. So I am aspirating. As I am aspirating, can you see something is coming out? Can you see column of water? As we have already put some water inside the mannequin. See, the water is coming out from where? From stomach. So ideally, in practical scenario, gastric food material content or anything will come out. Okay. The second and the third, how to confirm? I need one assistant. Come here. So third one is by auscultation method. So he will push some amount of air through this passage, and I will hear the sound in the epigastrium, in the stomach. Okay. So when I will ask you to push the air, you will push. Okay. So just connect it here. Connect it. So I am placing the stetho over the stomach. Push. Fast. Yes.
Okay, time's up.
So now I can hear the gargling sound.
Time is up.
Okay, so
Those who are
gargling
participants
sound
of Anna
can be
class,
heard if
please
it
move
is
to the
in
next entry,
proper
that is
place.
97.
And you can
Those who
also
are
do the
participants of
X-ray.
Pictionary,
By
stay in this
X-ray,
entry.
see that one line
Those
here.
who are not participating
This is
in any game
radio
after this,
opaque
you may
line.
leave.
This line is visible in X-ray.
I repeat,
as a prominent
participants
line.
of
So if you
Anna
do the X-ray,
move
the
to the
tip
next
will be
entry, that is LT7.
below the diaphragm.
Participants
So
of Pictionary, stay in this LT.
prominent bright
And
line. This line
participants
is bright
who
in
are not,
X-ray. Radio opaque
students
line.
who are not
So this line
participating
will
in
be
anything,
below
you
the
may leave.
diaphragm.
Thank
So
you.
by X-ray, by aspirating the contents, and by hissing sound, and by gush of air, gargling sound, you can confirm the ideal position of the Ryles tube. And how to fit? You can attach one tube here. First close this part, attach one tube like without plunger. Attach one tube. I need some water actually. So you can, so as I have put this, I have attached this with this tube. You can put some water and close this tube by bend. Okay, close this tube. Why closing is important? Bending is important because air can go inside. Now after giving the food, I'll keep it like this. Okay, ideally in a scenario it will go spontaneously. No need of plunger, because if you try to push it, you will go into the wrong track because of the pressure effect. There may be injury. So ideally it will go. That is it is mannequin. It may not be properly visible. And whenever you are removing, then just again bend the tube. Okay. Then disconnect it. Then close the opening. Okay. And another thing I forgot, before feeding you should fix the tube in the nose with adhesive tape. Okay, fix the tube, otherwise it may come out. Okay, so this is all. Thank you very much for careful listening.